Hi, hello everyone. We would like to first thank you, thanks USBC for fostering this space so we could still share our work. This presentation is the partnership work of ASTHO and NACCHO. So today's objectives is to describe why local and state agencies should collaborate, list some strategies to collaborate to advance continuity of care, and you're gonna learn some examples of these collaborations that have improved continuity of care resulting from this partnership work. I'm from NACCHO, the National Association of County and City Health Officials, so we really support implementation at the local level, so I'm gonna be giving the local perspective, and later on you're gonna hear from Gabby, who will be talking about the state approach. So NACCHO is the National Association of County and City Health Officials, and it's comprised of nearly 3,000 local health departments across the US, and our mission is to improve the health of communities by strengthening and advocating for local health departments. And NACCHO aims to create healthy, thriving communities. Within NACCHO, we have this unique work on public health breastfeeding. NACCHO has a comprehensive breastfeeding portfolio that sits in with the maternal, child, and adolescent team. And public health, as you probably know, works to change the community environment to make sure that healthy behaviors can be easy default behaviors. We understand breastfeeding as a matter of collective responsibility and not only as an individual parent choice. We believe that it takes the whole community to enable breastfeeding to be a feasible choice. So we work on implementing these policies, systems, and environmental approach that changes the context of communities and inside health organizations too, that will enable breastfeeding to be a feasible choice. We have lots of resources in our website from this past 6 years of breastfeeding implementations. And if you want to learn more about what these breastfeeding policy systems and environmental changes are, we have 2 open access journals, article at the Journal of Human Lactation. And to explain this better, we have adapted the public health impact pyramid into this breastfeeding impact pyramid. So you see on top, the top is in orange, is one-on-one education, right? So activities at the top of the pyramid requires lots of individual efforts and impacts one individual at a time. For example, you're providing nutrition education for a client, for example. Health education is super important. However, just providing education will require lots of efforts from that individual to ensure that they have to purchase fruits, vegetables, and whatever else you recommended. So if this client, specific client, lives in a food desert area and they have a tight budget, then they will need to put way more effort to make sure that they can follow your recommendations. So sometimes the choice to implement a health behavior is not feasible. It shows that where you live affects how you live. You simply cannot make healthy decisions if the health options aren't available for you. So in public health, we work more on the bottom tiers that have a increased population impact at one time. So we're gonna talk about this green tier, that is the context that we're gonna talk about in this presentation today. Think about changing the context, like a good example is fluoridation of water to prevent tooth decay. It doesn't require a lot of individual effort and it has a large population impact. For breastfeeding, a good example of this changing context is the Hospital Baby Friendly Initiative. Starting breastfeeding in a baby-friendly environment is much easier because of all the policies and procedures that are in place to ensure that families supported throughout their breastfeeding experience. But when these families, especially families in low income and the community of colors, leave those hospitals, they're not necessarily getting into a breastfeeding friendly community environment. So the continuity of care is being broken right after discharge. Also, parents don't have maternity leave, many don't have supportive policies at work, and probably no easy access to skilled lactation support. So again, it shows that depending on where you live, continuing the healthy behavior, like breastfeeding, may not be an option available to you. So to change this context of communities, those policy systems and environmental changes need to happen, and this may occur at local and state levels. Ideally, local and state agencies are working together to understand the needs of their residents and which specific policies and systems needs improvement and which ones they can influence, you know, in order to change this context where breastfeeding is taking place. We need to ensure that parents are enabled to embrace breastfeeding as the easy option. So this workplace support environment, creating breastfeeding friendly spaces in clinics, schools, childcare, having this easy, accessible, skilled support in the communities are all part of changing the context that local and states can do together. And CDC, which is our funder, the Division of Nutrition, Physical Activity, and Obesity, they have the 3 breastfeeding priorities for breastfeeding. And with NACCHO, they fund community support, so accessible and available support in the community through the continuity of care. And what's continuity of care? So continuity of care, this is a definition that we started, and we're still updating it. But continuity of care is the process by which families are giving consistent, high quality breastfeeding education and support, and this care is coordinated across providers, service institutions within their communities from the prenatal through until breastfeeding is discontinued. So this continuity of care is one of the factors that enables breastfeeding to be feasible in the community. Last year, we did a webinar series and divided continuity of care in those 4 buckets. So first, creating a breastfeeding ecosystem where support is available everywhere and it's coordinated. The second is the internal continuity of care. So it's the policies and procedures inside organizations like health departments and health centers and childcare that is supportive of breastfeeding. And then the community clinical linkages is what people think about continuity of care usually for breastfeeding. It's where when parents are discharged from the hospital and needs access to services in the community. And the last one is community to community partnerships. So all agencies that serves mothers and babies should also be breastfeeding friendly. So they need those partnerships. And if you'd like to know more about this, you can go to our website there and watch this. So here's what NACCHO is working on right now. We're going to talk more about the national partnering and the training and technical assistance. So the Breastfeeding Public Health Partners is a group of national organizations that collaborate to support national public health priorities to improve the health of families, infants, and children. So we've been active for over 5 years, and within the past year, NACCHO and ASTHO has been working closely together to support CDC grantees, CDC recipients at local and state level. Those that are working on breastfeeding, right? So at local level, CDC have the REACH program, which is the Racial and ethnic approaches to community health. They've been funding this program for over 20 years, and they focus efforts in communities that are disproportionately affected by chronic disease, which are community of colors and low-income communities. Not by coincidence, these are also the very same communities that have the lowest rates of breastfeeding. We know that breastfeeding is what? Yep, you thought right. Breastfeeding is a key factor that reduces the risks for many chronic disease, such as obesity, hypertension, heart disease, some types of cancers, not just for the breastfed individual, but for the breastfeeding parent, right? So for the first time last year, the breastfeeding continuity of care was included as a strategy in the REACH program under the nutrition strategy. So these recipients are in different levels of breastfeeding implementations, and NACCHO is working with them to support those. And ASTHO is doing the same for their state level recipients that Gabby will talk more about later. But here's just a timeline of the activities that we've been doing together with both SPAN and REACH. So the goal really is to identify opportunities to work together. They're working similar continuity of care activities. So to maximize the federal funding invested, right? So we're going to talk more about the state-local collaborations. There are many reasons why states and communities should leverage. We've seen that through this past 5 years of community implementations. We have these 2 webinars too that have some examples of agencies at the local level partnering with state level agencies. So if you are thinking about partnering with your local or state partner, you should definitely check those out. So like I said, there's so many reasons that they should collaborate. For continuity of care to be established across communities, locals and states must work together with the lens of collective impact. They can collaborate to leverage resources like tools, templates, policy templates, curriculums, educational materials like social marketing, campaign imaging, data collection, tools. So local agencies are usually delivering the direct services, and they're very short-staffed and busy, and they have little time to invest on research and developing and testing materials. So many look to their states for those types of templates that are already being tested. And on the other hand, the local agencies have expertise in their communities, and they have the relationship with the communities. So each agency in different levels have their unique expertise that can be leveraged. So they can amplify reach, they can increase awareness of what's happening within communities. There's no way to standardize anything or join efforts if you don't know what's happening in the community. Talking about standardizing messaging, this is one key point for continuity of care. There's no way to standardize anything if you don't know what's the materials and education and the language is in one community if you don't have this partnerships in place. And here, this is, since NACCHO's unique role is supporting local implementations, I would like to give a local perspective of what a breastfeeding landscape in a community looks like. These are the main players that states can look at for partnering and collaborating to establish continuity of care. One thing about breastfeeding is that it's unique. Each family needs different levels of breastfeeding education and support from pregnancy until breastfeeding is discontinued. We'll give you some examples next here of state and local collaborations from SPAN and REACH, and some focusing on some of these players here. First one is Connecticut. So Connecticut have 1 SPAN recipient and 2 REACH recipients. And they've been working together through the Breastfeeding Coalition. They are doing joint trainings for community members in rich communities to increase that community capacity to support breastfeeding. They are improving, they have a shared plan to outreach and improve worksite support. The state have this social marketing campaign with beautiful images and messaging that they're implementing across state, across the rich communities. They're engaging, they have this shared plan to engage the healthcare providers too, and they're creating this breastfeeding friendly physical office recognition program and toolkit that the REACH partners are implementing. And finally, they have this monthly awareness through this e-bulletins that tells what's happening in each community. So everybody's on the same page. And the next one, it's a little different, it's the Texas. Texas also have 1 SPAN recipient and 2 REACH, and they're leveraging their food services guidelines, which includes breastfeeding activities, through their early care education sites. So they SPAN recipients outreach to large child care centers, and the REACH, like I said, they already have this relationship with communities, so they reach the small in-home daycare providers, like Spanish-speaking informal providers. So that's 2 examples of great partnerships at local and state. And finally, I just wanted to leave this toolkit developed by BPHP. It's communities and states identifying and actualizing their roles in breastfeeding support. Also, within this toolkit, we have this state breastfeeding report card. So you can click in one state and look at the breastfeeding rates and breastfeeding funding, in which county they have the REACH program or other fundings, and links to the Breastfeeding Coalition. So we developed this to facilitate partnerships and opportunities to advance health equity by improving the impact of existing resources and the current investments in breastfeeding support. So on behalf of the breastfeeding public health partners, we hope this toolkit helps work across sectors and foster these strategic relationships with communities or states, and strengthen this public health infrastructure by building our collective capacity for transformative change. If you have any questions about this toolkit, you can contact either NACCHO or USBC. So just want to summarize here that CDC and partners are working to enable breastfeeding as a feasible choice through this continuity of care funded work. And that continuity of care requires multi-level, multi-sector partnerships from local and state levels. And that locals and state agencies working together, they can amplify, and then I wanted to do a word game here and say span their reach, amplify their reach, and impact and maximize federal dollars. So I just want to leave you with this question as a breastfeeding coalition. How can breastfeeding coalitions, who are the experts, content experts, engage with REACH and SPAN to help make breastfeeding the easy choice? As I mentioned, REACH, they don't necessarily have this content expertise in breastfeeding. And now I will turn over to our partner at ASTHO, Gabby Garcia.
Thanks so much, Harumi. I really enjoyed hearing your presentation. My name is Gabby. As Harumi had mentioned, I'm a director with Maternal Child Health Team at ASTHO. And in case you have not heard about ASTHO, ASTHO is a national organization. We're non-for-profit, and we represent public health agencies across the US, the territories, and the freely associated states. So ASTHO's members are chief health officials, also known as state health commissioners, And they lead on a day-to-day basis the health agencies in their jurisdictions, and they're dedicated to formulating and influencing public health policy and ensuring excellence in public health practice. Can you pause for a sec? ASTHO has 3 strategic priorities to help achieve its mission. It's leadership, advocacy and policy, and capacity. And it's through these 3 strategies that ASTHO members and its states in its leadership role advises or educates its members on policy, provides technical assistance and guidance to improve the nation's health. One of the things that we are really guided by at ASTHO is our vision and our mission for public health, sharing those with you. But really the vision is for state and territorial health agencies to advance health equity and optimal health for all of us, which I'm sure we can all agree is a very, very timely vision to be able to advance the equity for every single person within our states and territories. The Breastfeeding Learning Community that ASTHO has run for the past 4 years has been a community that builds on a previous cohort that ran from 2014 to 2018. And ASTHO uses its learning community model to support 18 states in the District of Columbia in that first cohort, and then also introducing barriers to breastfeeding. One of the 3 ways that we do that is using evidence-based strategies. The first cohort piloted and enhanced system-level strategies focusing on policy, data, strategic partnerships, and they were designed to maximize the potential and for those strategies to be sustained and spread across the states. States work collaboratively and with their breastfeeding coalitions, any task forces that they may have in the states or hospital associations. And in essence, they participate in a peer-to-peer learning network where opportunities for collaboration and for learning from each other are exemplified. Our current learning collaboration at ASTHO supports 16 SPAN recipients. And in case you haven't heard of SPAN recipients, they are the state physical activity and nutrition programs that are funded by CDC. They are recipients that are enabled through cooperative agreements of their own with CDC to build their capacity to implement evidence-based breastfeeding strategies, practices, and services in 3 areas. And those 3 areas are increased practices for supported breastfeeding in birthing facilities, providing professional access to peer counseling for breastfeeding, and then also ensuring that workplace compliance is met with federal lactation accommodation law. So the coalitions are a great part of building this. So our hospital associations, so our local partners, Harumi has very well detailed that state-local collaboration. But in order to promote breastfeedings, we look at 4 different areas and ways of supporting those public health and other agencies and prioritizing those breastfeeding efforts, allowing state health departments to be a role model in creating and enforcing strong breastfeeding policies, building those local champions and experts, which I'm sure we have many on the webcast today, to garner any future buy-in for state efforts among community organizations or hospitals, work sites, community members, and engaging local champions from communities of color that can ensure support for these communities and that interventions will benefit them. I'm sure on a local level, as you're thinking about these, you can think of many, many more ways that state and local collaborations will be able to meet your needs. Think about some now and be sure to add them to the list that we provided here. In addition, I'll pause on this slide for a little bit so that you can find your own state here from wherever you are joining nationally. These are the current SPAN recipients and the REACH recipients, and there are selected states with cooperative agreements to improve nutrition and physical activity. 9 states with both SPAN and REACH are also highlighted, and there's wide representation across the country. So can you find the pairs and find your state? Finally, one of the ways that NACCHO and ASTHO has really integrated some of their technical assistance is to advance joint technical assistance calls and resource trainings, referrals to subject matter experts. Sometimes you might have a question on, well, what does, something or the academia or research say about this? And so we're able to tap into our national network and to bring subject matter members who may have experience in this and share that information with local states. Harumi mentioned in previous slides that Texas and Connecticut were examples of these states working together, but we've also had calls with California and Arkansas to be able to conduct a joint technical assistance call with them, and several other states. NACCHO and ASTHO staff hear updates on projects and discuss and provide ideas ranging from collaboration to shared resources developed by ASTHO, NACCHO, other national organizations, and of course that capacity building support that comes from the locals. We also connect recipients to breastfeeding experts. And finally, we do on-site TA training in addition to collaborating with states on expert consultations, facilitation, and team building. For example, ASTHO Breastfeeding and Early Life Nutrition Innovation Sustainability Convening that we held in July of 2019 trained and engaged participants in utilizing techniques of boundary spanning and leadership to work across diverse sectors. I'll talk about that a little bit later on as well. But we invited basically the SPAN recipients and the REACH recipients to come as a team and develop a joint vision for breastfeeding and to develop joint strategies to increase breastfeeding in priority populations in an innovative and equity-focused way. NACCHO helped facilitate the meeting as well as share resources and facilitate a mobilizing for action through planning and partnerships exercise. As I mentioned before, Arkansas is one of the states that we have been working on. They really are training Arkansas State Park System employees on breastfeeding laws and best practices. We have spoken to them about sharing that information jointly with other states. We'll be doing another learning session and collaborating on some of the things that they have as an outcome of their project. But in order to work together, really, their team has advanced themselves because they are geographically and distance apart to do their work collaboratively to translate maps and materials onto breastfeeding accommodations in state parks into Marshallese or Spanish, and they're working to improve breastfeeding practices in childcare facilities, especially in the medically underserved and low-income counties. Thanks. And for the state of Pennsylvania, hopefully we have some folks joining from there. The Pennsylvania Department of Health and the Pennsylvania chapter of the American Academy of Pediatrics have worked with an equity work group consisting of Black, Hispanic, and Latinx community leaders. That work group is working to identify a plan to address and identify breastfeeding barriers and facilitators in their communities. The project planning committee also includes Allegheny County from REACH, the the Pennsylvania Breastfeeding Coalition, and the Office of Minority Health within the Pennsylvania Department of Health. And the group has identified priority areas to consider and will be working over the next several weeks to identify goals to address an implementation action plan. Some of the things on the table are prenatal care support for making breastfeeding plans and identifying supports, lactation support and consulting for patients in the community, healthcare worker education, and support relating to implicit bias on its impact on maternal cases, the benefits of breastfeeding and reducing stigma towards breastfeeding. All of that centers around advocacy around reimbursement for lactation support services and other breastfeeding supports. California is also a strong state and local community partnership. REACH is conducting peer trainings for Somalian, African American, and Mexican community members in several California counties to become lactation support providers. Public health advocates. A REACH recipient is working with faith-based communities to implement lactation rooms and offer lactation support provider trainings to grandparents. And SPAN has administered 9 guidelines to community clinics to assess readiness for becoming breastfeeding friendly. SPAN is collaborating with 5 organizations, 4 local health departments and a university to create breastfeeding friendly community clinics, while REACH participants are in Merced and Madera County. There are also associated counties that are working on this project, from Sacramento Department of Public Health, Orange County, Contra Costa County, Fresno, California State University, and Chico in Glenn and Colosa County. REACH is conducting paper trainings for 89 community members to become education counselors, and approximately 50% have completed the training, with the other half initiating training by the end of September. So a lot of good work that's happening there in California, and the partnership from the state and local perspective. I mentioned this a little bit earlier, but we did conduct a joint ASTHO Sustainable Convening and Visioning Exercise workshop in July of 2019 in Asheville, North Carolina. Each state team was comprised of members from the SPAN recipients and the REACH recipients, and brought together a team to participate in team building exercise and something that is called the Boundary Spanning Leadership Model from the Center for Creative Leadership. And through that, members really talked about the things, the processes that they go through every day in order to accomplish what they do, and then looked at collaborating across work sectors with their counterpart or somebody else. We had the ability to talk about health equity and clarify sort of any possibilities for a new vision for their partnerships at the state level. This meeting really laid the groundwork for some of the health equity visioning exercises and some of the innovation work and grants that we developed and issued later to states. But the more important thing is that development of strategies to increase breastfeeding among priority populations was done innovatively, in a partnership, and in a health equity focused way. As I mentioned, we were able to issue innovation grants to advance breastfeeding in health equity. We had the opportunity to provide that granting opportunity to all of the states, and we had 9 states who successfully attained the funding. Those states were Alaska, Arkansas, Illinois, Ohio, Missouri, Colorado, Pennsylvania, Utah, and Washington. So maybe there are some of you today that are joining us from those states. The successful grant recipients really wrote a plan for a vision of equity within their state, and were selected to continue work locally and in a partnership with either a REACH recipient, or if they did not have a REACH recipient in their state, a local organization that would inform that state action and build capacity at the local level. In addition, those states that applied really had made a commitment through our RFP process, request for proposals, to be able to use the tools and the guidance to create that vision for achieving health equity. That state vision was submitted as part of their plan, and they used some of the boundary spanning leadership tools that were introduced in the meeting in Asheville, but also could work on that vision locally, and we encouraged them to do so, so that they had more members contributing, more local members, more state levels into their vision for advancing equity in breastfeeding at the local and state level. The RFP was a guidance document where we asked states to use transformative versus transactional approaches to build their application, and then also emphasize a cross-sectoral or non-traditional partnership. So if they had not worked with some partners before, they were encouraged to do so. And then we also allowed states the ability on the financial side to be able to have another bona fide or fiduciary agent apply for the grants on their behalf. These are some examples of the innovation projects that are taking place right now. As I said, we do have 9 recipients, but we've chosen 4 examples here of some of the work that has really advanced. We are working with all the states to be able to work on their applications, but we've mentioned Pennsylvania before. Arkansas is working with early childhood education centers and family medicine clinics in medically underserved and low-income counties to assess and improve breastfeeding policies and procedures. And then also in Ohio, there are focus groups among African American and Appalachian women in Ohio in order to identify specific strategies to increase breastfeeding duration rates in these populations. In Washington, their partnership is working on African American community members and community-based organizations to develop health equity policies and anti-bias training for postpartum staff at birthing hospitals in King and Pierce counties, to the ultimate goal of improving breastfeeding rates in maternal infant health. So if perhaps you are in one of those states and joining us today, there might be some collaborative work or some of the things that you may be doing that could help these projects. I would encourage you to get a hold of your states and see if there's some way for you to contribute. In addition, these are the partners who we have at the table in Washington, Pennsylvania, Ohio, and the University of Arkansas Medical Sciences. Perhaps you can see some of your partnership groups there, or perhaps you are joining us today from one of these partnership groups. I'll pause a little bit here so that you can look at the list specifically and see if you're joining from each one of these states, if perhaps your organization is there. So in working together with NACCHO, we have had some great successes in terms of partnering, but we really wanted to make sure that we are looking for other opportunities for future collaboration. And so part of the work that we're going to be doing is joint office hours for Reach and Fan recipients. We thought that might be a good way to be able to have another method to ensure that partnerships are at the constant forefront for each of our groups that are working together, not only through these innovation grants, but for all of the states that may not have been in that group, so all of the SPAN and REACH participants. We're also disseminating via conference presentations, which is happening now. And so as we have the opportunity to talk about our work, we really get together beforehand and see if we can submit joint presentations to be able to highlight that good partnership work that's happening at the local level and then among our organizations. Some presentations have included contributions from state SPAN and some from REACH recipients, and like this one, a joint presentation. And then Harumi did mention this, but we are working to ensure that educational webinars and trainings are open to both SPAN and REACH recipients, so that future collaborative efforts and work can also continue. I'd like to share with you some of the references that we have. We do have a great source and wealth of knowledge through these learning communities at ASTHO. If you need any other information, please be sure to contact us or check out our respective websites. The Boundary Spanning Leadership Toolkit from the Center of Creative Leadership was also used, and so I wanted to really cite that information for them. They have a lot of resources that have informed the way that we ask states, SPAN recipients, and REACH recipients to work together. And those are some great resources if you and your team working on breastfeeding projects would like to also work and learn about the way that other partners in your field may be doing their work to allow for some more creativity and some more partnership work on any initiative that you're working on. Well, thank you for watching. I wanted to share with you also that we do have a breastfeeding email box both at NACCHO and at ASTHO where you can reach us. And I will read this quote: both national and state local partnerships increase awareness of evidence-based and innovative activities occurring at the national, state, and local levels to improve breastfeeding rates and ensure interagency communication and collaboration to promote breastfeeding support efforts. These partnerships not only strengthen the efforts of the individual programs, but collectively have an exponentially greater impact on public health outcomes. And so wanted to thank you. Make sure that if you have any local state examples, you share those with us. You can email those to us. I thank USBC for allowing us to present. Thank you, Harumi, for being a great presentation partner. And thank you all for participating.